Hi everyone, today we're joined by Brandon Webb, an infectious disease doctor physician with us here at Intermountain Healthcare for our COVID-19 update. As the United States sees an increase in cases, we wanted to give you the most up-to-date information on what's going on with COVID-19. Brandon, thank you so much for joining us. Do you want to give us the latest information on what the public needs to know about what's going on?
I'll do my best. Yeah, actually a lot has happened over the weekend. Most everyone's watching the numbers, and clearly we're still seeing a rise in cases. There is some favorable news in some of the areas where they were hit hardest and earliest. We are seeing some signs of flattening or peaking, so that's encouraging. There has been a tremendous effort to expand testing availability, and we're very reassured by the number of tests that are being conducted. There's also been a lot of effort on the side of developing and studying new treatments, and that's also encouraging as well. And lastly, I think we've been pleased to see communities embrace social distancing, and while we could definitely do better, we are pleased that communities are coming together and pulling together in that way.
Yeah, and on that note, I feel like I've seen a lot of people outside, which is great, but it's still important to practice social distancing while you're on a hike or with your friends and family outside, and just making sure that if you go somewhere, maybe it's just with the people you live with. That way you're reducing your impact of people that you're around. So because of that uptick of tests that we've been able to do over the past few days, can you tell us about what the cases are that are mild, moderate, and severe symptoms? A lot of people think that every test potentially is severe, but that's not necessarily the case.
Yeah.
Can you talk about that?
Absolutely. Yeah, that's a great point to talk about. So right now in Utah, we are testing thousands of people a day. Our labs, our major laboratories are testing at the top of their capacity, and we're pleased about that. I think the public would be interested to know that of all of the tests that are being done, 5% come back positive. And of those 5%, only 8% of positive cases are severe enough that they require care inside the hospital. So more than 90% of our positive cases right now, at least, have symptoms that are treatable outside the hospital.
Yeah, so on that note, if you think you might have COVID-19, and you don't want to get tested or can't get tested, what are your recommendations for people?
Well, first, our hope is that as we continue to expand availability of testing, that everyone who has risk factors for severe disease should be able to be tested. Mm-hmm. The testing criteria have continued to expand as our test capacity has expanded. And so not only are we testing those with high-risk exposures, high-risk travel internationally, but we're also able to test those who've traveled to hotspots domestically. We're testing those who are at risk for severe disease because of age, mm-hmm. Because of chronic medical conditions, pregnant women, health care workers, people with weakened immune systems. And in addition to all of those, we're now able to expand testing more broadly to people in the community who don't fit all of those categories, but whose symptoms do match the COVID-19 syndrome.
And speaking of symptoms, is severe throat one of those symptoms?
Yeah. COVID-19 is what I call a chameleon. In other words, it's a virus that can cause a number of different symptoms. Most commonly, it causes fever, body aches, dry cough, and shortness of breath. Mm-hmm. In about 15% of patients, it can also cause sore throat. And about 15% of patients can also have gastrointestinal symptoms like diarrhea. We're learning more and more about the symptoms of COVID-19. And one interesting fact that's been in the news a lot is that it does seem that there are a fraction of patients who lose their sense of smell as part of the infection.
And along the lines of fever, what is the high point of fever? At what point someone should be saying, hey, I actually do have a high fever?
Yeah, the easy one to remember is 100 degrees Fahrenheit.
Okay. Can we stop for testing if we think we've been exposed at all, or do we need to actually get approval to get testing done now?
So most of the testing locations have criteria that have been developed and aligned with our capacity to test. And we've worked really hard across the state to match the number of tests we have available to the people who need to be tested in highest priority. But like I said, as we continue to expand the number of people that we can test, our drive-up facilities are now accepting patients who have symptoms that match COVID-19, but may not have been exposed that they know of to a confirmed case.
Yeah, we just launched a couple locations throughout Utah, and you can go there instead of calling our COVID-19 hotline, which is really great if someone does want to see if they can get tested on the spot. Also, Summit County just announced a stay-at-home order that goes into place tonight at 12:01 a.m. Even if the state doesn't end up declaring some sort of stay-at-home shelter for the entire state, why is it still important for you to stay home and practice social distancing?
Yeah, so whether this is an order from the governor or whether it's something that you choose to do as a community member, the importance is exactly the same. So social distancing remains our single greatest tool for flattening the curve, like we talked about. So whether you live in Summit County or Salt Lake County or anywhere else in the state, social distancing is our most important tool as a community to pull together to fight the virus.
Yeah. And someone just asked, is outdoor activity still considered safe?
Yeah. Being outdoors is healthy, and getting exercise is healthy. Remember, the distancing in social distancing means staying 6 feet away from other people. And if you can do that while you're outdoors, being outside is good.
Yeah, and that was something I mentioned earlier, that it could get very busy outside as the weather gets nicer, so just being aware of your surroundings. Is there anything else you wanted to talk to us today, or any last points you wanted to bring up about COVID-19 in general, or testing capacities, or anything along those lines?
Yeah, let's talk about treatment for just a minute.
Yeah.
There's been a lot in the news about medications that may help with COVID-19. I think it's important for the public to understand that currently there are a number of medications that hold promise but remain unproven. And the most important way to identify whether these drugs actually work is in the context of clinical trials. And there's been a tremendous effort both in our state and nationwide to set up clinical trials that not only provide access to these medications, but also do it in a way that ensures safety and monitoring.
Yeah. We just got a few more questions.
Sure.
Do I need to wipe down my groceries when I'm bringing them home?
That's a really good question. The safest answer to that is if you can wipe down the hard surfaces on groceries, it's a wise thing to do. The more porous, like paper bags and other textiles and other soft material, is less amenable for the virus to live on.
Okay.
But hard surfaces are a great idea to wipe down.
It's like packages that you're getting in the mail, cardboard boxes, stuff like that too. Someone else just asked, all we're seeing is how to prevent COVID-19, but if confirmed, what are some treatments? Which you talked a little bit about some of the drugs that you guys are talking about clinical trials, but are there confirmed treatments at all?
So right now, we don't have good evidence that suggests that any one medication is the standard of care for COVID-19. Right now, the standard of care is to support the lung function. So what I'm talking about is patients who have severe COVID-19. We have state-of-the-art support for lung function that we deliver to patients in the hospital. If you don't require treatment in the hospital, the best treatment is, the basics that your mom always told you about. Rest, hydration. Those are the things that actually allow your immune system to do the heavy lifting and fight off COVID-19. And most people are able to fight it off on their own.
Yeah, I think we've seen the recovery cases go up a lot, which is great.
Yeah.
Someone else just asked, why is this more serious than the flu?
The virus behaves differently than the flu. The SARS-CoV-2 virus that causes COVID-19 attacks the lungs in a different way than flu does. And so it just behaves differently. And it actually behaves in some groups more favorably than the flu. So the flu can be really severe in infants and children. COVID-19 is much more severe in the elderly.
Yeah. We're getting lots more questions, so I'm still going to ask them
All
for
good.
you. In New York City, they're finding success with vitamin C. Someone asked what our thoughts are on that and if we feel like that would have success
Yeah,
for our
that's a
cases.
good question. In New York City, they're using vitamin C. It remains to be seen whether it's successful or not. For 50 years, there's been a lot of interest in the way vitamin C supplements the immune system. Vitamin C is a drug or a compound or a vitamin that we know a lot about, and it does have probably some mild antiviral properties. Whether it makes a big impact in severe cases remains to be seen.
Okay. And are pregnant women more at risk? This is something we get asked a lot about.
Yeah, we get asked that a lot. We have no data right now that suggests that pregnancy is a risk factor for either acquiring the disease more frequently or for having more severe disease. I think it comes up because our care for mom and baby is top priority. And so because of that, pregnant women are high priority for testing, but not necessarily because you're more likely if you're pregnant to get it or to have severe disease.
Okay. What is the point of social distancing if the virus can live in the air for up to 3 hours? And I don't know if that point is correct, incorrect based on research, but what are your thoughts on that?
I love that whoever brought that up is asking those questions because that's a great question. The study that showed that the virus is capable of living in the air for 3 hours didn't study whether the virus can stay in the air for 3 hours.
Okay.
What they did was they actually artificially suspended the virus in a drum for 3 hours and then checked to see if it could still cause infection, which it could. In reality, this virus is actually fairly large, and so when you cough or sneeze, the virus isn't able to float on the air for long distances or stay suspended in the air for a long time. Gravity pulls it down onto surfaces, and then we touch those surfaces, then we touch our face.
Got it.
That's far more likely to be a mechanism of transmission than breathing the virus in that's floating in the air.
Okay. And how long should a sore throat last before we actually get tested if we have a sore throat?
Yeah. Most patients who have COVID-19 and have a sore throat also have cough or shortness of breath or body aches. So or fever. So if you have a sore throat and fever and swollen glands and no cough, you should probably contact your primary care physician or use one of the other routes of contacting a healthcare provider to make sure that you don't have strep throat or one of the other causes of sore throat.
Got it. And is wearing a mask in public recommended?
It's actually not recommended. And the reason for it is that masks serve as a deterrent to touching our face, but they don't necessarily block the ability to inhale virus particles if you were close to someone who coughed.
Okay.
The masks that we wear in the healthcare setting are in high-risk situations different than the masks that are available to the public.
Last question for you. What is our hospital's COVID-19 census right now?
That's a great question. It varies from day to day, and it depends on which hospital. Like I said, statewide, we have about 8% of our cases that are hospitalized. And right now we're at around 400 cases statewide.
Okay.
And so 8% of 400 are in hospitals around the state at this time.
Thank you so much for joining us today, Brandon.
Yep.
If you have mild to moderate symptoms and would like to speak with a healthcare professional about COVID-19, you can call our COVID-19 hotline at 844-442-5224, or you can use our online symptom checker, which is located on our website, which you can go to at intermountainhealthcare.org. It's located in the bottom right-hand corner. Thanks, everyone. We'll talk to you later.